Good evening, respected colleagues. My topic of discussion today will be the radioanatomy of hips and the sacroiliac joints. Now, as Dr. Malini already said, the hip joints are also a ball and socket kind of a joint, and being a ball and socket joint mainly allows a very wide range of motion with a reasonable amount of stability. The other ball and socket joint is the shoulder joint. Now, if you compare the hip and the shoulder, unlike the shoulder, the hip is a weight bearing joint, and therefore as compared to the shoulder, the hip has a relatively more stable anatomy with relatively less range of motion as compared to the shoulder. The femoral head forms the ball and the acetabular socket forms the socket for the hip joint, and both of these have very smooth weight bearing surfaces which are covered by smooth cartilage. Now we will go into the normal anatomy. This is a unfast view of the acetabulum, a lateral view of the acetabulum. The deepest portion of the acetabulum, that is here, is a non-articular portion of the acetabulum. This is the medial wall of the acetabulum, and it is covered by a fibrofatty tissue known as the pulvinar fat pad. This does not have cartilage overlying it. The remaining acetabulum is covered by a cartilage which is lunate shaped, and it's called the lunate cartilage. Inferiorly, the acetabulum is deficient, and that is known as the acetabular notch. Now, across this notch there is a ligament which is the transverse acetabular ligament, which sort of bridges this acetabular notch. From this transverse acetabular ligament arises the ligamentum teres, which attaches to the fovea capitis on the head of the femur. Now, around the acetabulum there is a labrum, just like the glenoid of the shoulder, and this labrum in the region of the acetabular notch, it merges with the transverse acetabular ligament, and also it merges with the cartilage at the margins of the acetabulum. Moving on to the femoral head, the femoral head is almost spherical but is slightly flattened anteriorly and posteriorly, and it has the fovea capitis for the ligamentum teres. Then there is the neck of the femur, and then comes the greater trochanter and the lesser trochanter, which are joined by a ridge known as the intertrochanteric ridge or the intertrochanteric crest. Now, the blood supply of the femoral head is very important to understand, because it helps us to understand the causes for avascular necrosis in fracture neck femur. During the early childhood, when the fascial fusion has not occurred, the femoral head receives its blood supply from the artery of the ligamentum teres. But once the fascial fusion occurs, the ligamentum teres artery gradually involutes, and then the blood supply comes mainly from the circumflex arteries, which encircle the intertrochanteric region of the femur and then send tributaries, branches, cephalad, which go towards the femoral head and supply the femoral head. Therefore, if there is a fracture in the region of the neck, these vessels can get disrupted and predispose the head to avascular necrosis. The